What are extrapyramidal symptoms, EPS? Have you ever heard of extrapyramidal symptoms? These are movement disorders that can occur as side effects of certain medications, especially antipsychotic drugs used to treat schizophrenia. Understanding these symptoms is important, particularly for women with schizophrenia, as they can impact their treatment experience. Extrapyramidal symptoms arise from disruptions in the brain's extrapyramidal system, which helps control movement and coordination. These symptoms can show up in different ways. One common type is dystonia, which involves sudden muscle spasms and contractions. This can lead to unusual postures or twisting movements that can be quite uncomfortable. Another symptom is akathisia, which is characterized by a feeling of inner restlessness. People experiencing akathisia often feel an uncontrollable urge to move, making it difficult to sit still. Then there is Parkinsonism, which includes symptoms similar to Parkinson's disease. This may involve muscle stiffness, slowed movements, and tremors. Tardive dyskinesia is another concern. This condition causes involuntary and repetitive movements, often affecting the face, tongue, or limbs. Tardive dyskinesia can develop after long-term use of antipsychotic medications, making it particularly concerning for those on prolonged treatment. The risk of experiencing these symptoms can vary based on the type of antipsychotic medication. First-generation antipsychotics, also known as typical antipsychotics, are more likely to cause extrapyramidal symptoms. In some populations, the rates can be as high as 60%. On the other hand, second-generation antipsychotics, or atypical antipsychotics, generally have a lower risk of these symptoms. However, some, like risperidone, can still have a higher incidence compared to others like clozapine, which has the lowest risk. Certain groups are more vulnerable to these symptoms. Women with schizophrenia, especially older women, are at a higher risk for medication-induced Parkinsonism and Tardive dyskinesia. Younger men may be more prone to acute dystonic reactions. A history of prior extrapyramidal symptoms and higher doses of antipsychotics can also increase the risk for everyone. Managing these symptoms is essential in the care of individuals with schizophrenia. Clinicians often have to balance the benefits of antipsychotic medications with the potential for these side effects. They may choose medications that carry a lower risk of extrapyramidal symptoms when possible. Regular monitoring for early signs of these symptoms and adjusting treatment accordingly can help improve patient outcomes and adherence to medication. Extrapyramidal symptoms are important to understand, especially in the context of treating schizophrenia. Recognizing and managing these symptoms is vital for ensuring a better quality of life for women with schizophrenia who may be more susceptible to these side effects.